Check out the blog to find out how you can normalize your blood pressure drug-free in 3 weeks or less. www.bloodpressuretreatment, hypertension, a health label meant for high blood pressure. If left alone, hypertension possibly will cause organ damage by putting increasing pressure on the arteries and heart. Hypertension over time pushes up your odds of suffering heart failure, heart attack, and stroke. We will look at a few of the available treatments intended for hypertension which are helpful and by and large simple to take. Lifestyle changes. Changing your lifestyle is the first step and in the majority of cases and the most important step to lowering blood pressure. In a good number of cases, lowering sodium and alcohol intake, keeping weight in the ideal range, taking part in regular exercise, and stopping smoking are more often than not adequate to control high blood pressure. High blood pressure medications. There are an extensive variety of medications used to deal with high blood pressure. Although a good number of high blood pressure medications can cause side effects. Diuretics drop blood pressure for the most part by making the kidneys emit greater water and sodium. This lowers the fluid volume right through the body and widens blood vessels. ACE inhibitors. Angiotensin-converting enzyme inhibitors block production of the hormone angiotensin II, a compound in the blood that will narrow the blood vessels and raises blood pressure. By dropping production of angiotensin II, ACE inhibitors allow blood vessels to enlarge, which lowers blood pressure and pushes up iron output. Beta blockers block some of the effects of the sympathetic nervous system. This increases the heart rate and increases blood pressure with stress and activity. Beta blockers drop blood pressure in some part by lowering the rate and force at which the heart pumps blood, the proper high blood pressure medication for you. Healthcare providers take a variety of factors into consideration whilst deciding what drugs ought to be used at the outset. They may perhaps additionally consider probable side effects, additionally general health, sex, age, and race, the degree of the high blood pressure, any other underlying medical conditions, and whether specific drugs ought to not be used. Check out the blog to find out how you can normalize your blood pressure drug-free in 3 weeks or less. www.bloodpressuretreatments.org